Welcome back to this week's Monday Motivations, brought to you by Gates Brain Health. Dr. Randall Gates, the man is here with us today. He's a board-certified chiropractic neurologist and chiropractic physician, and today we are talking about peripheral neuropathy. I needed to say it right at the beginning.
You nailed it.
Get it over with. You can say it from now on. Tell us about what this is.
So, in essence, think of your nerves going into your legs or your hands like wires.
Okay.
And those wires are kind of fraying. They may lose the insulation on them, or the wire itself may be damaged. So for all intents and purposes, the nerves are dying and degenerating or really irritated.
Which is causing pain, I'm assuming?
Can cause pain,
okay.
Can cause burning pain, horrible pain, or it can cause numbness and tingling.
Oh,
some people have no
weird.
pain.
Interesting. Okay,
Yeah.
So who are these people that typically get diagnosed with this?
It's typically in the higher age demographics, the 6th to 7th decade. About 1 in 10 people over the age of 65 have peripheral neuropathy. So it's pretty common in our seniors.
Okay.
Say it that way.
And also common in our seniors is diabetes. Is that a common pairing too?
It is. So half of neuropathy cases are due to diabetes. So about 50%.
And the other half?
The other half, lots of times, that is what patients are told. Half the time it's diabetes, half the time we really don't know. The reality is that if you think of neuropathy as a pie, half is diabetes, the other half, about a third of the other half is pre-diabetes, which in the last 15 years we've actually found is super important for these idiopathic cases of neuropathy. The literature actually came out of University of Utah. I mean, it's really groundbreaking. Another third is gluten. Okay. Is what we think. And about the other third are literally like upwards of 80 to 100 different causes. Heavy metals, vitamin deficiencies, bone marrow issues.
Okay, so typically if somebody was to get this diagnosis, what is it that they would be told they can do for it?
Lots of times they're told they can take medications to blunt the pain, but so many don't have pain, and so they just have numbness and tingling. It may affect their balance, as I've mentioned on other broadcasts. So lots of times they just live with it.
That doesn't seem fair. Like, that doesn't seem right. Like, no one should be able to, should be in pain, especially chronic pain like that. Or like you said, numbness can lead to all sorts of other complications. So what is your kind of practice on somebody who comes in with peripheral neuropathy?
Well, kind of like what you're getting at. I like to be tenacious and really dig in and say, okay, well, what is causing this A? So through detailed lab work, you can actually figure out the cause in upwards of 78% of cases. Wow. So I would find a doctor who's really trying to figure this out. And then if you figure out, hey, you have a gluten sensitivity, or if you have pre-diabetes, which actually is discovered through something called a glucose tolerance test in this patient demographic, then you might want to start working on dietary changes. Half hour of vigorous exercise a day is being looked at as a treatment for this pre-diabetic peripheral neuropathy. So there's a lot that can be done, and I encourage all those out there just to really, you know, don't accept no as an answer, and really try to figure out solutions. And
so if they're listening to this, some of the symptoms that might apply to them is tingling and numbness in hands and feet, or just are there other places?
Lots of times it starts in the feet. It can spread to the hands. There are many different types of neuropathy too. And as we discussed before I came on, low back nerve root impingement can mimic neuropathy. Arthritis in the neck, strangulating the spinal cord, or disc bulges can also do the same thing. So getting a really thorough neurological exam is very, very important in this patient setting.
Yeah, well, I said it before, no one should be in pain. I know that is what your kind of mantra is like, you want to be able to help people get through the pain and figure out a cure, or at least alleviate their symptoms as best as possible.
As best as possible, yeah, exactly.
Exactly. Well, I know there are people who are probably watching this right now who need to go ahead and contact Dr. Gates, no matter what you have. We do these interviews every 3 weeks, so it's always informative, and I really appreciate you taking the time to speak with us.
Of course, I appreciate you having me.
Anytime, anytime. All right, we'll be right back after this quick break.